Hi, my name's Kathy Bonadio. I am a dietitian at WellSpan's Bariatric Surgery program, and today's topic is going to be dining out. So the term dining out can refer to going to a restaurant, it can be takeout, it could be fast food, whatever you consider dining out. It's a meal not at home. So for most Americans, they dine out once a week. Some people dine out every day. The American Cancer Society reports that Americans consume 200 calories more when you eat a meal out as opposed to eating the meal at home. If you dine out multiple times a week, this can lead to a significant weight gain over time. So we do recommend to limit eating out about once a week. So when you do eat out, try to make it a planned meal. So a planned meal is just as it sounds. It's a meal that you plan with friends, family. You want to do less of the convenience eating or unplanned eating. That tends to be fast food, takeout. And that's because the majority of the foods there tend to be high fat, from fried foods, from high fat meats, cheeses, also a lot of processed carbs from breads, rolls, desserts, sugary drinks. When eating out's planned, it does give you the opportunity to plan out your meal ahead of time. And that's helpful because you don't have people around you ordering, you don't have the smells. It also gives you time to look online, to look up the nutrition information. So restaurants will offer the calorie content on the menu, but there's a lot more that they don't have on the menu that you can look up on your own before you go. So you can use apps such as MyFitnessPal, Lose It, or Bariatric. Those do give you a lot of restaurant meals that you can look up, the nutrition information. Restaurants also will have that information on their websites that you can look up. So it'll provide not just the calories, but it'll show you the proteins, the carbs, the sugars, and the fats, which are all very important in helping you to make the healthiest decision you can. So if you're only a few months out from surgery, there's going to be a lot on the menu that you do want to avoid. So a good option is if you're at a restaurant that offers an a la carte menu. They'll usually have a piece of chicken, a chicken breast, or grilled salmon, broiled crab cake. So you can always just order that off the a la carte menu. Restaurants usually have salads, so they'll have the option to add a protein. So whether it's chicken, shrimp, salmon, same thing. You can just order that meat. You don't have to order the salad. You can just ask them for that piece of meat. So those are easy options. You don't have to order a huge meal. You can just order that piece of meat. If you're, say you're in the soft phase, you're only 3 weeks out of surgery, maybe there's a chili or a bean soup that you could order. Those are options as well. So regardless of what protein you do order, just ask that they not cook it with butters or oils, and any sauces that may come with it. Just ask for them to be served on the side because the sauces do tend to contain a lot of fat or sugar. So if you're going to a restaurant that serves your favorite, whether it's chips or rolls, breads, breadsticks, they bring them out while you're waiting for your meal. They can be very hard to resist. So a couple options, if you're with a group, can't necessarily speak for the whole group, so maybe just try to keep them at the end of the table where they're out of reach. If it's, just a couple of you, maybe you can ask them to just bring one per person. That way you don't have, 2 or 3 per person that you're eating. Or depending who you're with, you may be able to say, why don't you not bring them at all? Because chances are there is someone else at the table that would be happy to not have that temptation as well. So if you show up at a restaurant and you're really hungry, the appetizers can be really tempting. But appetizers do tend to contain a lot of fat. They tend to be fried food such as, mozzarella sticks, onion rings, creamy dips like cream cheese-based dips, cheese-based dips, just to name a few. So if you show up and you are really hungry, instead, look for just order a side salad or a broth-based soup. So to avoid showing up at a restaurant and being really hungry and then having everything look really good, have a protein snack, an hour or 2 before you go. So when you show up at the restaurant, you're hungry but not starving, and it does make it easier to make a healthier choice. When it comes time to order your meal, when the server comes and you let them know what you want, ask them to bring a to-go box with your food. That way, when your food comes, if you know it's too much, which usually at a restaurant it is, that way you can put part of it in there already. So you put in, maybe cut half the meat off and put it away. Depending on what stage you are after surgery, maybe you put all of the starch away. But only leave on your plate what you know you're able to eat. Because if you leave it all on your plate, thinking about ordering a to-go box at the end, chances are you'll be done eating before a lot of other people because you're eating such a small portion. You are more likely to pick at it while you're sitting there talking and everyone else is still eating. You are more likely to find yourself doing that. So if you put it away at the beginning, you don't have that option. I have heard from numerous patients the first time they do overeat or eat too fast and then not feel well. It does tend to be at a restaurant or with a group of people just because they're distracted and they're not really paying attention. So you do want to make sure you're being really mindful while you are eating so you don't have that experience. So remember mindfulness when you are eating out. You do want to make sure you are taking small bites of food. Make sure you are putting your utensil down. Make sure you're chewing it to applesauce consistency. If you are ordering a beverage, because remember, you do have to follow the 30-30-30 rule. But if you do decide to order one, just remember to avoid the sugary drinks. Stick with either water. You could do unsweetened tea. Just don't add any sugar to it. You could take your own meal. They're easy to throw in your pocket or in a bag. You could take that to add to your water. But just try to avoid any of the beverages with sugar. And that includes alcohol as well. When deciding what meal to choose, don't be afraid to alter a menu item. Oftentimes, if you order an item on the menu as is, there's going to be added fats or high sugar sauces that you will want to avoid. So don't be afraid to ask for substitutions. So any breaded, crispy meats, they've been fried. So you do want to ask for grilled or steamed meats instead. And like I did mention earlier, have the sauces on the side. That way you can determine how much of the sauces that you're using. And if you're not sure, ask the server. And if they don't know, they'll be happy to find out for you. Vegetables, you could have really good intentions and try to order, a double serving of veggie, but then they might come out and you can tell they've been cooked with lots of butter. So ask for your veggies to be steamed without any of the added butter on them. And you could always ask for a little bit on the side and just add a small portion yourself. So starches usually come with your meal. So whether it's rice, potatoes, pasta, mac and cheese, a better starch option would be a baked potato or sweet potato. But when you go out, they do tend to add butter or add brown sugar. So those things, again, ask for them not to put it on. A baked potato can be rather dry, so salsa makes a great low-fat, low-calorie alternative to butter or sour cream that you could add to it. Another option is you could replace the starch altogether, and I mentioned earlier adding a double veggie. So you could do that. Or just if you're with, family, friends, maybe one of them wants it, you could take it home and have it as leftovers for the family. So salads seem like a good go-to when you're trying to make a healthy choice. Unfortunately, they can actually end up higher in calories and fat than some of the other menu items. So to cut down on fat, make sure the meat is grilled. So don't do the crispy chicken, do grilled chicken. Ask for the dressing on the side. And your best bet is to dip the fork in the dressing and then pick up the salad that way, as opposed to dumping the dressing on the salad. When you dip the fork in and then pick up the salad, you'll still get the taste with each bite, but you won't use nearly as much. And that does give you a way to use your favorite dressing, even if it is a little higher in fat. You still get to use your favorite dressing. Cheese is often added to salads, and if it's shredded cheese, it tends to be a lot of cheese. So it does contain protein, but it contains a lot of unhealthy fat. A quarter cup of shredded cheddar cheese is 110 calories, 9 grams of fat. So if skip the cheese altogether or just ask for less cheese to go on it, because really the protein it contains, you shouldn't need it. It should already come from your protein that's on the salad, from meats, shrimp, salmon, hard-boiled egg, whatever protein is on there, that's sufficient. Now, added sugar that you might not think about on salads could come if there's dried fruit added to it. Maybe there's dried cranberries. Maybe there's a glazed nut of some sort. Those are all going to be sources of added sugar. So ask for those not to come on it. Maybe you can replace it with fresh fruit, or if there's a salad option that comes with the fresh fruit instead, go with that. Restaurants do carry a large variety of pasta and rice-based dishes. It is best to avoid those, especially if you're within the first year of surgery, because it's very filling. If you forget to eat the protein first and you start by eating the pasta or rice first, you're going to feel very full very quickly, and you won't be able to get to the protein food. A lot of these pasta dishes also tend to come with high-fat sauces, whether it's oil-based, wine-based, or cream-based. So that's another thing to watch out for. Maybe order one that's tomato-based instead. Something else to keep in mind if you've had the gastric bypass, if you do eat a meal that's too high in carbs, such as the pasta or rice, and you're not able to get enough protein, it can cause late dumping, which is similar symptoms to dumping syndrome, but it can occur a little later. You might notice the symptoms 30 minutes to 60 minutes after, and that's just from consuming too many carbs with not enough protein. And depending on the sauce that's on it, you could have the discomfort of dumping from the high-fat sauces as well. If you go to a restaurant that offers mostly burgers and sandwiches, you may need to get a little creative. So rolls and breads will act the same way as pasta and rice, making you feel really full. So you can ask the server to not bring the roll at all. That way you're not tempted to eat it. Oftentimes they will have lettuce. Usually they might put lettuce on the burgers. So you can just ask for that and use that as bread instead, or just eat the meat by itself with a fork. They'll usually offer salads, so you could also put the meat on top of a salad. If you're at a Chinese restaurant, ask for the meats to be steamed. So sometimes the meats will be breaded and then they tend to be fried. So ask for the meats to be steamed. Also ask for the sauces to come on the side because they do tend to be high in sugar or fat. So these restaurants will often have a Weight Watchers menu or another healthy menu that indicates the meals come with steamed meat, steamed veggies, the sauce is served on the side, and usually they'll come with white rice. But again, if you can avoid the rice, just eat the steamed meat and veggies. These restaurants often have edamame as an appetizer, and that is a good option because it is a good source of protein and fiber. So family pizza night, I know that's really popular with my family, probably is with yours too. Unfortunately, pizza shop pizza, although really good, it's very high fat, lots of grease. So chances are you might not feel very good after eating it. So one option is to make pizza yourself at home. So I don't mean you have to roll out the crust yourself, but maybe use a low-carb tortilla or Flat Outs are a brand that are great to make pizzas with. Usually you'll find those by the deli in the store. And you can use low-fat mozzarella or other low-fat cheese for that. And you can switch up the kind of sauce you want. That way you're not stuck with just one sauce. You can also switch up the type of meats. So maybe someone in the family likes ham, someone else wants chicken, someone wants turkey pepperoni. You're able to have that variety. And it'll be much healthier choice than going out to get it or ordering it in. If you do end up getting pizza from a takeout, blot off as much of the grease as you can that's on the top, and you'll actually get a significant amount off. And then try to avoid the high-fat meats like the sausage, bacon, and pepperoni. And then stick with just one small slice and order a side salad to go with it. So breakfast is a popular meal to eat out for, especially weekends, days you have off work. So a safe bet seems like eggs, great protein, but you have to watch. In a restaurant, they're typically cooked with butter and oil. So you might notice you don't feel well. You might feel fine with eggs at home, but then in a restaurant, you might notice they don't make you feel very good. So just request that maybe they cook them in nonstick spray, that they don't use the butter or oil. If you order a meal that comes with toast or home fries, you could always sub it out with fresh fruit. Or if you do order a slice of toast, ask for it to be dry so they're not putting butter on it. If you have an option to choose an English muffin or biscuit or croissant, your English muffin will be the best way to go. It does tend to be less fat and less calories. Or you can go with a wheat toast instead. It is best to avoid ordering pancakes, French toast, waffles, because just like rice and pasta, they will make you feel very, very full very quickly. If you like to use any syrup or jellies, ask the server to bring out the sugar-free. They usually do offer it. It just isn't out on the table, but they'll be happy to bring it to you if you ask. So in terms of beverages when you're out for breakfast, fruit juice, chocolate milk, very popular. Unfortunately, they're just both very high in sugar. So stick with the low sugar options, decaf coffee, decaf tea, or if you enjoy milk, go with a small glass of low-fat milk. So I mentioned earlier, it is best to try to avoid the quick convenience eating like fast food, but there are times, maybe you're on a road trip, many instances where you just might not have another option. So I have compiled a list for you to help you to make a better choice when you are in that situation. Most fast food restaurants will offer salads. So again, go with grilled, not breaded. If they have light dressing, ask for that, and then don't use the whole pack of dressing. Just use half of it, because that salads can be great until you add the dressing to it. So just stick with half a packet. Most will also offer a grilled chicken sandwich or a grilled chicken wrap. So depending on where you are after surgery, maybe you don't have the bread at all. You just eat the chicken and veggies off of it, or maybe you just eat part of the bread. Chick-fil-A is one that offers grilled nuggets. So those are great. But just avoid the Chick-fil-A sauce because it is high fat, high sugar. Other common condiments that tend to be really high in sugar, sweet and sour sauce, barbecue sauce. So if you like hot sauce, that would be a better bet. So if you enjoy Mexican type food and you're going out to, say, Taco Bell, Moe's, Chipotle, they offer bowls rather than using a tortilla. So those would be definitely a better option there. And if you substitute beans for the rice, that's a better way to incorporate a complex carb. So beans are a better source of fiber, some protein. So that would be a better carb option. In terms of what meat you want to add, chicken will be the leanest. There is lean pork and lean beef, but chances are when you're at a restaurant, they will be a more fattier beef or pork because they tend to be more tender. So chicken's probably your best option. And then the condiments like cheese and sour cream, they're both going to be higher fat. Now guacamole, that is higher in fat as well, but it's a healthy fat. So if you're looking for the better option there, go with guac. And also load up on any veggies that they may have. So if you do plan to go pick up food and then take it home and eat it, try to avoid any condiments on it at all. And then when you go home, you'll have the better, healthier options that you can add yourself. Wendy's has chili. So, if you're 3 weeks out from surgery, that's a great option for you. Starbucks and Dunkin' both have egg bites. So those are great protein, high protein, low carb options for you. And convenience stores, whereas they can have a lot of unhealthy options, they actually do have a lot of good options. They'll have hard-boiled eggs, cheese sticks, Greek yogurts, and nuts, just to name a few. You can also get ready-made sandwiches or salads, and all the tips that we talked about today, you can use those to help you make a good choice. If you're a couple years out of surgery, you are going to be able to tolerate some of the bread products. I talked a lot about trying to avoid the rice, the breads, the pastas. So the further out you get, the more you're going to be able to tolerate them. It is best to limit how many of them you eat, but don't feel like you're never allowed to have them at all. So do your best to try to just limit how much you have when you go out. So take maybe the top roll off of a burger. If it's a wrap, tear off as much of the excess as you can. And sometimes wraps can be really big, so it may actually be a considerable amount. If you're eating a sandwich, just eat, half the bread and then maybe just eat the meat out of the other half if you're able to. So lots of ways that you can still enjoy it, but just not have as much of it. Now, home delivery services, they have become very popular. So if you are HelloFresh, Home Chef, Freshly, those are just a few, and they can vary. They could be meals that are completely made and all you do is heat them up. They could send you all of the ingredients and you have to prepare them yourself. And they'll usually have options, maybe a heart-healthy menu, maybe a diabetes-friendly menu. So just make sure you are, whichever they have, choose the healthiest option that they offer. And actually, a newer one is called BariBox, and that one is specifically for people that have had bariatric surgery. So if a home delivery system is something you use or something you're interested in, I would encourage you to look that up. And the great thing about the delivery systems, whichever you use, they tend to be very well controlled with portions. So it's a good way to learn what an appropriate portion size is. So thank you for your time today. I hope my suggestions will be helpful for you the next time you find yourself dining out.